So what should a patient look for? What should they ask the doctor that's going to be doing their dental implant surgery?
Right. Of course, you want to know about their background and training, and more importantly, you want to know about their cases. Talk to a patient. That would be very helpful. Look at some of their before and afters, and ask them what kind of complications have you had or do you have. Make sure they're properly trained, they're using good materials, and get a good idea of what their process is like.
But how do you know what kind of good materials they're using?
Well, that's
There's two types of implants, right? I mean, for the most part.
Yeah.
Like the small ones are mini implants.
Right.
And then traditional implants.
Right.
You do not like the mini implants.
No. If they're using mini implants, to me that kind of indicates that they are probably not trained, because no university is going to train a doctor in using mini implants. And so you want to do a little bit of research on the doctor and make sure that you're comfortable with their background training and their process.
Okay.
And so for many patients, they wouldn't have a clue what implant brand they're using or what type of materials they're using. But there are some things you can do. Like in my practice, I only use commercially pure titanium. I don't use titanium alloy. And about 80% of the implants on the market are titanium alloy, and alloy is a combination of different metals. So I only use pure titanium, and that way, I don't have to worry about the trace metals that are in the implant.
They last longer?
They last longer. We don't see as much bone loss. It's much more favorable to the tissues. There's a lot of reasons why, but just doing your homework and knowing that the place, because you're spending a lot of money and you're making a big commitment to the doctor, to the practice, and to yourself, and so you want to do your homework in making sure that you know that it's going to be done right.
Now, I don't know how to read X-rays, and chances are people that are watching this don't know how to read X-rays, but you brought X-rays. Why?
I did, only because you can kind of, and maybe it's naive of me to think that somebody could actually know what's going on here, but it's just different situations, implants that are falling out, that that were placed in the bad position, they're kind of all over the place. And this is basically what you get when
Let's take a look. So what are we looking at here?
Okay, so this is a case where obviously this patient has spent a lot of money. I mean, they went in and trusted the doctor to do the best that's possible, but in the end, they're left actually worse off than they were, because now there's implants that are falling out with no bone left, and they still don't have their teeth. The next X-ray is an X-ray of a full mouth of mini implants. And by the time I saw this patient, the teeth were broken off the mini implants, and we had to go in and retrieve them and back them out and then put in the permanent implants, or the standard implants, and restore his mouth. So bottom line, making sure that you've got somebody who has experience and that can manage your case properly.
Now, as you know, I have a lot of medical doctors on the show and a lot of dentists on the show, and they only like to tell me the good stories. Are you saying that there's like this secret world out there of implants that are failing, implants that are like getting infected or cracking?
That is a huge problem.
Really? So it's going on out there, but they don't talk about it on my show.
Yeah, no, because of the, of course, in the marketplace, we want to bring the price down so we can service as many people as possible. But with that comes some pretty negative aspects, in the sense of using materials that are really pretty cheap. I mean, I've got cases where I've seen implants that had rust in them. There was rust on the implants. I mean, so that tells me...
So you don't mind being the fix-it guy, the repair person for these problem cases?
No, I don't mind it. I mean, of course, I would rather have a new patient that goes smoothly and I don't have to deal with that, get them the first time. But I do enjoy this aspect as well, because it pushes me as well. It pushes my abilities and my knowledge, and the great thing is I've been able to work through it, and now I'm very confident at it. I know I can fix these cases. I have no doubt about it.
Now, if somebody's coming from out of state, can you do a lot of this via Skype, or a lot of, X-ray?
A lot of the information I can gain. If they're in St. Louis, I can gather with my staff as much information as I can. So by the time they get to me, we have a very comprehensive plan in place. And a lot of this I do remotely, so that they don't have to, so they're not going back and forth between Newport Beach and St. Louis. Another big part of the process was, with the resin-wrapped implant dentures, they break a lot. They have a tendency to break. And so in my practice, we have designed a prosthesis or the set of teeth that don't break.